They are very important for you as a nurse. If you delegate someone, you need to know if, okay, you must know, I can say, if that person you delegate has capacity to provide that care. Because if something happen, you are the one who gonna, like, explain. You are the one who go into the code, or stuff like that. So you need to know, as soon as you delegate someone, ensure that person is able to provide, that care properly, I can say. So those are the 5 rights. So you need to know before you delegate someone. Okay, 5 rights of delegation. So the RN must ensure these 5 rights are met before delegating a task, guys. Okay, so you must ensure these 5 rights are met, guys, you as a RN. So number 1 right task, for example, is this a task that can be delegated? Generally routine, non-invasive, low risk, predictable outcomes. And number 2 right circumstance, is the patient stable? Are the resources appropriate? And 3 right person, is the delegate competent or legally authorized to perform the task? Is the RN competent to delegate? And number 4, right direction communication, is the instruction clear, concise, correct, and complete? Includes what, when, and expected results. And number 5, when you delegate someone, number 5, right supervision, evaluation. So the RN must monitor the task that you have been delegated to that person, provide feedback, and intervene if necessary. So the RN retain accountability for the outcome. Okay, if something happen, so you as the RN, so you guys are responsible. Okay, so task not to delegate RN responsibility only. Category assessment. Okay, judgment planning. For example, developing the plan of care, formulating nursing diagnosis, determine goals, outcomes, teaching, initial patient education, example diagnosis, medication side effect, discharge teaching, reinforcement teaching, okay, can sometimes be delegated to a LPN, a LVN. You see? Evaluation and specific procedures. Delegation to unlicensed assistive personnel with a UAP or CNA. You know, CNA, they can do ADL, bathing, grooming, dressing, ambulating, any activity of daily living of the patient. So yes, CNA can do it. Anything required nursing skill, assessment, or judgment cannot perform, guys. Yes, you can. Yes, UAP can do the stuff, but however, let's say if something need anything required nursing skills, okay, so assessment or judgment, then CNA cannot do it. Okay, we'll need to call LPN or RN. And routine monitoring vitals, stuff like that. Specimen collection, environment, bed making, transport, restocking, okay, supplies, right? For example, let's say you start a care of your patient. You need a IV pole. Yes, a CNA can just go grab a IV pole for you, bring the IV pole to you. So this is not a problem, okay? So the CNA can grab a IV pole, can grab an oxygen machine for you. It's just like, equipment. CNA cannot start, cannot do it, cannot apply, but yes, can just grab the IV pole and oxygen a machine for you. So when it comes to postmortem care, okay, be careful, because sometimes, patient have, like, some specific, I can say special, for example, what I can say, like, let's say engage rain, okay? So you as a LPN or RN, you need to be there, okay? Okay? In order, let's say later, if family asks you, okay, I remember my mom had like, her, like, engagement, so I would like to see it, please, from that since long times ago, okay? So this is for you. But CNA can still like clean the body, stuff like that, and you put the, whatever tag for the patients, guy. Okay? So delegation to licensed practical vocational nurses, okay? So tasks LP and LVN can perform, okay? Routine, skills, dressing change, suctioning, urinary catheter, okay? Insertion, medication administration, oral, subcutaneous, intramuscular, IMA medication, and routine, IV, piggy, bags, okay, check states, facility policy, very important. And data collection, auscultation, lungs, bowel song, measuring patients and comparing to baseline, okay? So on the right side, tasks LP and LVN cannot perform RN responsibility. Initial assessment, but can collect data. IV push, medication starting, blood transfusion, chemotherapy. Interpretation of data, development of a new nursing diagnosis. Next, task LPN, LVN can perform. Stable patient, care for stable chronic patient with expected outcomes. Okay, so task LPN, LVN cannot perform RN responsibility. Care for unstable patients, so those requiring complex care or new admissions. So prioritization framework according to Maslow hierarchy of needs, guys. Prioritize psychological needs, ABC, before safety, belonging, esteem, and self-actualization. If some questions, guys, for example, when they ask you in your exam, you will need to use Maslow. Number one, you're gonna look if there's any airway issue, breathing, circulation, for example, food, water, elimination, pain, sex, and rest. So if there's nothing in your exam, the question they ask you about psychological needs, okay? So then you go to number two, which is safety and security. And 3, 4, 5. Okay? NCLEX focus, prioritize intervention addressing ABC first. You know that. So pain is often a high priority, sometimes, often, okay? Especially acute. So if your patient in severe pain, like 9/10, from 7 to 10/10, yes. But let's say your patient complains of pain 10/10, then you have a shortness of breath patient. Okay, you're gonna see your shortness of breath patient first, and you will see the patients who complains of pain. Okay, but if you have a chronic patient, for example, required like a care, some stuff like that, and you have a pain 10/10, then you will see the patient who complains of pain 10/10. A, B, C, D, E, so just always follow. So those rule guidelines, guys. So, A, airway is the airway pattern, obstruction, structure, intubation needs, so highest priority. And then B, breathing is the patient breathing adequately. Rate, depth, auto-saturation, signs of distress. And CD, circulation is blood flowing, heart rate, blood pressure, hemorrhage, shock fluid status, okay? And disability level of consciousness, neurological status, Glasgow coma scales, and pupils, and more, okay? So you need to know those stuff. So what I do for my student, I just give them one free copy. But however, if you purchase my book, so this is my book, guys. If you purchase my book, so I can give you a free copy as well. So this is my book, guys, if you need to buy my book. So my book, I just put, for example, I put the disease itself and the definition, causes, pathophysiology, you need to know for each disease and complications for that disease, and signs, symptoms, nursing intervention, and teaching, and NCLEX priority. Okay? So this is my book. So this is straightforward, guys. You can get a full copy at careforallcadou.com. Okay, let me show you my website. So you can go there. Okay, this is my website. So if you are looking to purchase my book, you can go on my website at careforallcadou.com. So this is my website, guys. Okay, you can go the learning bar, you click on the learning, and then you go on the, if you are PN, you go on PN. If you are AN, click on AN, and then you will see the book. So you just click on this and then you buy your book. Okay, add to cart and more. Okay, and I will have a new session, okay, for NCLEX review. Will be started on April 15 to August 15. It's a 4 month, full 4 months. Then if you are interested, you can go on my homepage, you click on it, and then you can register. Okay, you can just register. You click here and you will see all the information. It doesn't matter you are in the US, Canada. Okay, you can change here for US money. So this is, so I offer, like, payment a plan, so you can do it as well, guys. Okay, so let me go back to my thing. So this is how the book looks, guys. Okay, highlight topic you must know for your NCLEX. Okay, this book, LPN, LVN, and RN can use it. So if you see some stuff, and then for example, they are not part of your learning, so you just, like, skip. For example, blood a transfusion, not for LPN and LVN, so this is only for RN. But however, as LPN and LVN, you need to know if there's any, like, IV issue. I can say, like, phlebitis, like, what you can do as a LPN. Okay, transfusion reaction. So as a LPN, you need to know them. LPN and RN can, like, check, for example, before blood transfusion, they can check together everything. But however, to LPN to LVN cannot do it, and LPN cannot, like, administer blood product. You know that, guys. But with RN, they can just verify the other stuff like that. Okay, so this is my book about sepsis. You see, for example, the definition, and then stages, and early sign, late sign, priority nursing care, and manifestation, and then NCLEX, like, priority. So what you really need to know. Okay, infection. So this is my book, guys. So it's a good book. If you haven't purchased yours yet, so go right now to get it on my website. So I already show you at careforallcadou.com. I'm taking Zelle Cash App. You can pay via Zelle Cash App. However, my phone number is 941-288-0745. Okay, so this is the book. Okay, so I put everything you need to know for your NCLEX, my book. And I'm working on my pharmacology book. Okay, so what I do, for example, if I go back on my website, let me show you something, guys. So where's my website? Where's my website? Okay, so on my website, guys, so let's say, for example, you are looking to buy. Okay, let me go on the home page. Okay, so you are not comfortable with any, like, type of medication classes, so let me show you something. Okay, you go on, this is my store, always on learning. So this is where you can go. is about consultation. I know I have more stuff. Okay. I have a skincare product too, guys, if you're interested. Okay, I'm looking for, if you need to buy, for example, okay, Master Pharmacological. I was looking for that, guys. Okay, let's say you are not, like, comfortable with cardio medication. You can just go on my website, you purchase, okay, and then I put a full PDF for you, all the medications about cardiovascular system. Okay, you just open it and then you purchase. It's only $29. This is so cheap. You will get all the medication about cardio. Let's say you want respiratory, and then you just click on it, so on my website, and then you can buy it. $29, all the medication you need to know for respiratory system. And then next, endocrine. Okay, so let's say you need the full Mondo. You need all the medication, so it will cost you only $60. I know most of the students, they purchase the $60 one because it has all the medication class you need to know for your NCLEX. Okay? There is a PDF when you go, you purchase. So when you finish, like, making the payment, and then you will see the PDF, you download it. But if you want to print, you can print for yourself a color, in color, guys. And this is psychiatric medication, and then more. I put all the medications here. But if you need all the medication, only $60 for everything. You must know them for your NCLEX exam. Okay, so let me go back again, guys. Okay, let me go back. I was on my book, so this is how the book looks. The book itself, it's $60. However, if you want the book including all the medications, it will be $100. So the book, and then plus all the medications you need to know. Okay, this is the book. Okay, so remember that for each disease, you need to know the definition, the pathophysiology. So this is where some, student fail NCLEX exam, because they keep memorizing and they don't even know about the pathophysiology. So let's look, for example, for Bell's palsy. You need to know the definition and the pathophysiology. Okay, causes, signs, symptoms, and diagnosis and treatment, nursing intervention, and NCLEX priority. That's the way you're supposed to study for your exam. Anytime when you go for your exam, okay, and then you will be fine if you study like that and you understand, them, and then what theory you need to apply as well. If your client, has a breathing issue, like airway issue, circulation, safety, and then more. Okay? This is the book, guys. This is my book. Guillain-Barré syndrome. Okay? Guillain-Barré start from the lower, okay, and go up. And your client at risk for airway obstruction, okay, due to the disease process start from lower and then go to upper here. Okay, so this is one of the complication of Guillain-Barré, so you need to know that. That means, so your client's airway will be your priority. And then next, traumatic brain injury, intracranial pressure. All the diseases, guys, out there for you. Odds, asthma. Okay, and I put a few medication at the end too, guys. Look, few medications. Okay, so let's say you want to purchase this book plus all the medications you need to know. Is gonna cost you very cheap, $100 only. I'm the cheapest lady, guys, in the world when I compare, other vendors. So I'm the cheapest one. Okay, I'm the cheapest one. Okay, so I put all the medication at the end. Okay, this is cardio, aneurysm, pulmonary embolism, hypertension, heart failure, pleural effusion, RSV, TB. Okay. And then I was explaining, I think, okay, I was here. Okay, let me back to these guys. Okay. Okay, safety risk reduction and prioritize the patient who has the greatest risk or is experiencing a life threatening problem over a patient with a less serious risk or chronic issue. Okay. Example, a patient with low blood pressure and a altered mental status is a higher priority than a patient with a fever. You know that? Example, medication errors for risk or infection. Infection, guys. Control breaches are higher priorities than non-urgent teaching. Acute versus chronic. Okay, you have to see your chronic first, and acute first, and then you will see your chronic after. Urgent versus non-urgent, you're gonna see your urgent first and non-urgent after if you have time at work. Unstable and stable, your unstable will be your first patient you're gonna see, and then stable you will see them after. Doesn't mean you like ignore your patient, but remember that you are dealing with unstable. You need to see your unstable patient first. So unstable, for example, hemorrhage, sudden change in status, sign of shock, okay? New chest pain, unexpected fighting, stable, for example, chronic conditions, COPD, diabetes, hypertension, unless they are acutely exacerbate, okay? Expected fighting, post procedures, example, mild pain after surgery. Then you can see them first. Least restrictive, least invasive. I always choose intervention that are less, okay, restrictive or invasive when appropriate. Example, try distraction or reoriented before resorting to restraint. Okay, so I always try to do that to your patient. Okay. Another example, so choose oral medication before considering an IV. Okay. High priority changes, so new or sudden onset chest pain, shortness of breath, and altered mental status, active bleeding, sudden drop in blood pressure. Life inside, like stridor, absent breath, and then song, and rigid abdomen, profuse bleeding, and lower priority changes. Expected findings: mild pain after surgery, stable vital sign. On a chronic patient, expected side effect or a long-term medication. And chronic issues: mild dyspnea from stable COPD, controlled diabetes. And more high priority changes: new post-op concern, hypotension, because with hypotension, patient can end up to hypovolemic shock, and if hypovolemic shock not treated properly, and then we end up with cardiogenic shock, okay, or decreased urine output in patients 2 hours post surgery. And lower priority changes, so routine care, IV fluid running low, need an antibiotic dose, and more, guys. So if you purchase my book, I can give you this copy free. You don't have to pay. Assigning staff based on patient needs. Patient condition, for example, best staff. New admission requires full assessment plan of care. This is for RN. Patient required wound care, suctioning and oral med stable, LPN, LVN. Rational routine technical skills and stable medication administration. Patient required frequent vital sign and feeding assistant, stable UAP. So the rationale behind that, so routine monitoring and basic ADL. Patient with DKA, diabetic ketoacidosis or severe sepsis, unstable complex IV med, so will be 4RN. Requires complex assessment, titration of IV medication, example, insulin drip, vasoactive, and frequent adjustment to the plan of care. Patient who needs reinforcement, teaching on, for example, cross walking, so will be for LPN, LVN, or RN, okay? LPN, LVN, or RN can do these guys, okay? So like I said, if you need a copy of my book, go on my website at careforallcadou.com, then you will able to buy it, guys, okay? Those are the meds, okay? Medications you must know for your NCLEX exam. I put only medications I know you really need to know for your exam, okay? Okay, I think that's all, guys. Okay, so this is a list all the diseases you need to know for, like, pediatric, okay? Asthma, okay, you need to know cystic fibrosis, cardiovascular system, CAG, congenital heart defect, you need to know them. Or rheumatic fever, Kawasaki disease, so NCLEX love this disease now. So now the include in your exam, okay? Gastro, pyloric stenosis and intussusception, and more, guys. Celiac disease, nephrotic syndrome, glomerulonephritis. So you need to know this. So all our kids disease, you need to know them for your NCLEX exam, okay? So review them very well. And those are medication for each, medications for all, okay? And you know this disease, let me show you something. This is the only disease you can use high aspirin dose. Only this disease, guys. Kawasaki disease, high aspirin dose, okay? Otherwise, no, you cannot administer high dose or aspirin dose on children, you know that, okay? But this is the only disease you can do it. And then okay, I did this one, okay. That was about okay, some case study. I do case study with my staff too, okay? Let me do one quick case study, guys, with you. Or beside that, I'm a nurse, but I'm a I have my bachelor as a educator, guys, as well. I really love what I'm doing, guys. So I'm very patient with my student, and my student, they always like, mention that I really love you, the way you explain very well. You are very patient, okay? Okay, so let me show you. Let's just do a quick case study. So the first one about cardiovascular. A 50-year-old male arrived in the emergency department complaining of causing subternal chest pain radiating to his left jaw. Rate 8/10 is diaphoretic and reports malnausea. So his medical history includes hypertension and hyperlipidemia. Be careful, guys. So anything chronic, guys, please leave them there. So now you are dealing with your patient. So you need to check the chief complaint of your patient. So what bring your patient to the emergency department, okay? Complaining of causing subternal chest pain radiating to his left jaw, okay? So this is your number one, because patient used to live with, like, his hypertension and high cholesterol level and stuff, or other, whatever other chronic diseases, Okay. So this is the vital sign. Okay, blood pressure 148/92, heart rate 110, and so respiration rate 22, and saturation oxygen on room air 94%. And initial ECG ST segment elevation in leads 2, 3, and a VF. Okay, ventricular fibrillation. Okay. Question. So which action should the nurse prioritize immediately after establishing IV access and obtaining the initial ECG? Administer API dose of oral metoprolol. Administer sublingual nitroglycerin and obtain repeat vitals. And C, initiate a continuous intravenous heparin drip. And D, insert a Foley catheter for strict intake and output monitoring. Okay, you know the answer is B. So the first thing you're gonna do, first of all, you need to administer your nitroglycerin. So what is the rationale behind that? So why you gonna do this first? The patient is presenting with classic sign and ECG evidence, preload, and coronary spasm. So they'll be reducing myocardial oxygen demand and ST segment elevation STEMI or an acute MI, which is life threatening, guys. Emergency caused by coronary artery occlusion. So the immediate priority is to relieve myocardial ischemia and pain decreases, okay, oxygen demand and restore perfusion. So this is the first thing you're gonna do. Okay, more, guys. So if you need my book, so my book is very, very helpful, guys. Okay, I can show you one more time before I end this live. Okay, so my book is really helpful. Let me show you a copy of my book again. So reason people love my book, especially my student. So you don't have to, like, read a lot of stuff. Just stretch forward, okay? Lung cancer, for example, definition, causes, signs, symptoms, pathophysiology, complication, NCLEX priority treatment, and nursing intervention. Teaching for your patient. Pneumonia, you see, the same thing. Definition, pathophysiology, signs, symptoms, risk factors, diagnosis, nursing intervention, and NCLEX priority for each disease. So if you need my book, you go online at careforallcadou.com. Okay, this is my website. Okay. And if you feel overwhelmed, guys, you can buy, okay, I have some natural supplement. You can go purchase them. I have MOEM. MOEM is really good. Okay, you can buy this one on my website. Okay, Noni. This is a powerful supplement. Gonna boost you guys. And I have some, skincare products, okay, for acne, and if you need to light your skin, so I have them as well. Okay, and then that was me when I was, like, you see, guys, I had big belly. And then this is me now. So if you need this product, so you can buy online. You see about me, guys. Okay, let's say if you have your license outside of, US or Canada, you are looking, to bring your license here, so I can help you out too, guys, to change your license in the US or in Canada. Okay. Oh, this is my student. We were working together on your wall. And if you are my student, you can, if you are my student, you will not pay for online questions. For example, I can assign you my account, okay, give you my username and password. If you are RN, you can go on my bootcamp. If you're LPN, you can go on my UWall. So this is free for you if you take training with me, guys. So it was a pleasure to be with you. My name is Nurse Reina, okay, Cadou, and my phone number is 941-288-0745. Okay. If you're looking to purchase my book, you can go online at careforallcadou.com to get your book. Okay, my book is straightforward, guys. Okay, and you see, look my book, the way I made my book. Look, straightforward, everything you need to know for your NCLEX. Okay, and let's say you are doing some questions on bootcamp or you can use my book to double check. Okay. You must know those topics, guys. You must know them. Okay, bye-bye. See you. Go online right now to purchase my book. Go online right now to purchase my book, guys, at careforallcadou.com. If you are struggle, okay, with your review, so this is the best book ever, okay? This is the best book, guys, you can have. You see, all the disease, what you really need to know. Okay? No pressure. SIDH, gestational diabetes, celiac disease, pancreatitis, Crohn's disease, and then more, guys. Yeah, it's a good book. It's a good book. So everyone purchased my book. They really like it. They say, "Oh, I really like your book." Instead of using, huge book, and then this is just for only 200 something pages, guy. Everything you need to know for your NCLEX exam, so I just put them there for you. I don't put stuff you don't need to know for your exam. You see? It's a good book, guys. Only $60. But if you want medication, so it's gonna be $100. Then I will give you a full, let me show you. Okay? So if you need for medication master pharmacology, so if you need a full copy for medication, so it will cost you $100. The book itself, including the medications for all classes, then will be $100. So how you can buy at careforallcadou.com. This is my website, guys, careforallcadou.com. So let's say you decide you are not comfortable with cardio medication. You can go online, you click on it, you purchase, and then after your purchase, then you will see a PDF link. You download all the medications you need to know for your NCLEX. So respiratory, the same thing. So endocrine, the same thing, and then more. Okay, OB. But if you need all the medications only, will cost you $60. All classes for all 11 systems. Okay, this is my website, guys. Or I was explaining about if you need to register for your review and LPN. So if you know you are a student, you like to memorize stuff, so you don't have even to call, please do not call me. I really like student really understand, okay, the material. So you understand, for example, let me show you. You understand, let's say you are doing, okay, Let's say, for example, you are doing diseases. You need to know what it is, signs, symptoms, complication for group, okay? Treatment, nursing intervention, the pathophysiology. That's the way I like it. You see? So this is all the diseases you need to know for kids, guys. You need to know all those diseases. I think it's only 6 pages. Okay? All the diseases for pediatric, you need to know them. Okay? I think it's 6 pages. Oh, 9 pages. Only 9 pages. You need to know them. All the diseases for pediatric. And for maternity, okay, those are questions. So when you buy from me, I give you free questions, or I can assign you. Let's say you just buy my book, I can give you 1 week free. You go on my boot camps or my UWall, and then for free for 1 week if you purchase my book, and free question. And I give you a guideline, anything you need to know. And for example, that was about case study. And those case studies say like NCLEX exam. Okay, like your NCLEX exam, guys. Okay, those case studies, like your NCLEX exam. Okay, and you need to know those stuff too. Delegation and prioritization, very important. And according to your test plan, okay, this is where I use this document in order to summarize for you. Okay, so always use your test plan abroad as well, guys. It's free. You can go on Google. You just type test plan 2023, but 2026. So will be effective April 1st, 2026. Hello, hello, hello. How are you guys? Hello, hello, hello. Okay. Okay. So I'm going to end my live right now, guys. So if you need to purchase my book, you can go on careforallcadou.com. It doesn't matter even you are in Canada, you are in the US, even I don't know, all over the world, guys, you are. So if you really need a copy of this book to prepare your NCLEX, LPN, LVN, or and so this is one of the best book in the world. Even my project management guys say, oh, you made this book. This is a good book. It's a good book, guys. Very helpful and straightforward. You cannot miss any question in your exam with this book. Okay? Kawasaki disease, touch infection. This section cover only maternity. And you need to know normal pregnancy, like whatever. You need to know those signs. Positive, probable, and presumptive subjective sign, which is the mom field. And abnormal and normal during pregnancy. And newborn respiratory complications. And then more, guys. Everything's there for you. Those are medication. And postpartum, very important. You know the first thing your client at risk for postpartum hemorrhage and DVT, deep vein thrombosis, complications, labor and delivery. You need to know the stages. I remember I had stage 2 for my NCLEX. I had stage 2. You need to know the stages and what happened on each stage. Placenta previa and placenta abruption. Preterm labor, delivery, spontaneous abortion, competent cervix, and torturing fetal demise. Analgesics, so those are medication. I put a few medication for antibiotic, anticoagulant, antiplatelet, antidepressant, and these are with me. and more, guys. Yeah, those are hypertensive medication. And more, guys. So bye bye, because I have to do a lot, because today I have review with my student. I'm going to prepare documents for them. Yes, so if you want to study with me, and so you can go on my website, you book, okay, for a consultation. This is my website. If you want to study with me, you go on my website, careforallcadou.com. You click on learning, okay? You click on learning and consultation, okay? And you can make an appointment with me. If you know you are a, like, student, you like to memorize, so please do not call me, guys. I'm telling you that. So I really want you to understand each disease. So that is the reason, guys, I am making my book like that for you. It's so easy to remember each disease, guys. For example, let me choose one disease. I'm singing, guys, okay? For example, if I take rheumatic fever, you see, definition, signs, symptoms, a nursing intervention, and NCLEX priority, okay? Study like that. Stop memorizing for NCLEX. You will not pass. You will not pass, guys. You will not pass. For example, you have a sickle cells a patient. Sickle cell. So you need to know the complication with sickle cell. And in sickle cell, our red blood cell, guys, are completely changed, the shape. They are not the same shape. They become like a C. That's why they call it sickle cell, C. Okay? Completely, the shapes is changing, guys. So that's why they call it sickle cell. So your client at risk, you need to teach your patient to stay hydrated, and then oxygen, very important for your client, stuff like that. And assessment, treatment, and NCLEX priority for your patient. Pain control is priority, and fluid, okay, oxygen, and avoid high altitude. You know that. Okay, avoid dehydration. So treat infection. So the more your sickle cell patient, get infected, and then the more the at risk, guys, you're not gonna, I can say, it's not treated properly, so I cannot fight over. So the more they get infected, so the more they're gonna take time to to recovery, I can say. This is my book, guys, okay? So, for example, you have your patient on mechanical ventilation. So the alarm sound, beep, 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 beep. I used to work on the floor like that in the hospital, guys. Your priority will be the patient. First of all, you need to check the patient. So if the patient is able to breathe properly. If not, then after that, you can go to the machine to check the machine. Your patient is number one all the time. Safety. Okay? Bye-bye, guys. Bye-bye. So if you need my book, you can go on my website at careforallcadou.com. Okay? So anytime when I have even 30 minutes, I will come in, just do a quick live and then just leave it for you. Sometimes I will able to do some case study. Case study, very important. Okay? This is a nice... okay, I have 20 case studies on it. Cardio, respiratory, endocrine. Those are stuff you will see in your exam. Even you're not gonna see them word by word, but at least if you're able to do your practice, then you will be fine, guys, in your exam. GI, renal, hematological system, HIT, immune, integumentary system, anaphylactic shock. So when you purchase my book, I just give you those questions free, guys. OB, epiglottitis, burns, trauma, smoke, mental health, psychiatric, oncology, spinal cord compression, infection control, sepsis, and sepsis shock. Bye bye, guys. If you need my book, go online right now at careforallcadou.com. It's only $60. It's on sale, guys. Okay. And if you need everything, medication is gonna cost you $100. But if you need medication by system, okay, by only system, so it's gonna be $29. I take Zelle, I take Cash App. 941-288-0745. Bye, guys. See you next time. Bye bye. Route 80. I can see you, Route. Bye bye, guys. I gotta go. I gotta go. Take your time to review my live, guys. And purchase, don't forget to purchase your book at careforallcadou.com. Powerful book. So with this book, you will be able to master your NCLEX exam. Stop memorizing. Stop memorizing, guys. Stop memorizing. Stop memorizing, guys. Stop memorizing.